Good evening. My name is Roxanne Chabot from RBC Consultants. Welcome to another Skin Chat. This evening, we're going to review the challenges and nuances of treating rosacea in Latin American patients and the role of cleansers and moisturizers as adjuncts. As speaker, we have Dr. Carmen Gloria Gonzalez. Dr. Gonzalez is a pediatric dermatologist, fellowship in pediatric dermatology at the Feinberg School of Medicine in Northwestern University, and a member of the American Academy of Dermatology. We also have Dr. Charles McKeever. Dr. McKeever is dermatologist, CHM AAM CSS at Johns Hopkins Pacifica Salud Hospital in Panama, and AAD International Fellow. We'd like to thank our sponsors, CeraVe, for making this educational event possible. A couple of logistic tips before we start. If you're having issues hearing the webinar, you can listen to the presentation using your telephone. Just select phone call in the audio pane and the dial-in information will be displayed. If you're having technical issues or if you would like to submit a question to our faculty, please submit your question in the question chat pane on the right-hand side of your screen. At the end of this webinar, a survey will be emailed to you within 1 to 2 days. We would greatly appreciate it if you could fill in this short survey. Finally, within 1 to 2 days of the webinar, a certificate of attendance and a recording will be sent to you. Again, if you would like to submit a question to our faculty, please use the question chat pane on the right-hand side of your screen. And I typed in a little note there so you could see where you need to type in your questions. So without further ado, I will pass the floor virtually to Dr. Charles McKeever.
Hello, good evening to all. How are you doing? Thank you for the invitation to CeraVe and consultant, RG Consultant. My name is Dr. Charles McKeever. And we are going to prepare with the polling question. So regarding rosacea triggers, which trigger do you believe we as dermatologists can influence the most throughout education? There are several choices. First choice is avoid spicy foods, skin barrier and its purpose, quit smoking or vaping, general skincare routines, or controlling alcohol intake. There is no wrong answer. This is a survey so that we can attest or determine what everyone believes is the most important to them. So it's going to be interesting that we can take an idea of where we all stand. So pretty much what I was expecting, most of us are going to go for, maintaining this proper skin barrier, and the rest of us are going to probably head out for the general skincare routines. Very interesting, 5% decided to control alcohol intake. So we don't have any alcohol for you tonight. So basically, this is the outline of what we're going to look at today. Sorry. Basically, we're going to see everything that encompasses the outline of what we're going to talk about in this talk. We started by, this is the poster we published in RADLA 2022, where we were talking about the things that encompass Latin American patients and the problems that we're having in Latin America with different types of cleansers and hydrating lotions. So basically, when we start, we have to do a background check in the publications, and we started looking around. And of course, rosacea is an inflammatory skin dermatosis that is about 10% of the population is said to have this problem. However, it's very limited to the white population and the information that is out there. A lot of clinical presentations can occur throughout rosacea and in Latin skins, and there's a wide range of different types of skins. So this is important because we have to be able to have different keynote things that we can look for when we're interviewing our patients to determine whether or not rosacea may be present. So basically what was a panel of 5 dermatologists convened in November 13th, and we sat around and we discussed different cleansers, different problems that we have been having in Latin America, and what we agreed on were 5 general statements. These statements we will be discussing throughout the webinar. So basically, these are the ones that we listed, and we will start one by one. But then first, when we were looking through the literature, it was very interesting that there's over 168 journals. However, only 50 included skin of color or black skin. And it's very interesting that out of these, 21 were clinical trials, 29 were reviews, and 9 of these only ended up in consensus guidelines. When we talk about rosacea, and every country has its own individual characteristics, it's very important because we have to establish treatment patterns in these. So our first statement was, rosacea is an inflammatory skin disease that leads to an impaired skin function. It commonly involves the face, and very often the symptoms of rosacea can be bothersome. Most patients will refer pain, stinging, burning, itching, or facial flushing. And this is important because these are data that we get during the clinical interview of our patients. And then 5 to 10% of all the people have rosacea. This is the studies that we have found in the literature. Most Caucasian women in the Northern Hemisphere. However, this is probably biased because most clinical trials are conducted in Northern countries. Latin America is having trouble with the proper studies and the help to get these studies conducted, which is why it's important to keep the information going and make each country do their own little representation. And recently, Asian trials have been done, and also in African skin colors. So this is important because we're starting to see that rosacea isn't only a white pathology. It's seen in different types of skin colors. Very important because sensitive skin is not well recognized at once. If to the untrained eye, it can be diagnosed wrongfully, and a wrong treatment can be installed. So when people have erythematous telangiectasia rosacea, often without any treatment, these patients will describe itching, burning, stinging. This is without any treatment. It's very important because if a person of skin color comes to our consult, this is a little tip that we can take off from this, and you can ask your patient, do you have these sensations without doing anything to your skin? And this you can take away. And it's very important because when the skin barrier and the stratum corneum is open, most of these symptoms are most frequently presented. In studies that have been conducted, in a 5-year longitudinal study, 705 patients with rosacea were used. Out of these, 421 were African American, and 284 were skin of color. And this is important because this is a good trial in order to evaluate. However, the problem is that in order to diagnose, you have to have that clinical eye, and deeply colored skin is very tricky, but it's not impossible. And that's part of the reason why we're here to help. We're here to help you know that in Colombia, there was a clinical trial also conducted. Out of 33 dermatologists, they pulled all their patients together. They were able to pull 10,000 patients, out of which only 291 were rosacea. So it wasn't so prevalent as 10% or 5%. It was only 2.8%. However, the information keeps being skewed because it's not inclusive and it's not conclusive. to all the countries in Latin America. So our second statement is, while the clinical presentation of rosacea is across diverse phototypes, phototypes widely differ, and clinical features are generally less conspicuous in individuals with deeper skin tones. And here's where there are tricks to where we can use, because there is no Latino skin color. Latinos have a wide range of skin colors. For example, I am Latino and I am white Latino, but there are darker olive skins, there are darker tones, there are mixtures of races and mixture of cultures. So it's very difficult to get a clear diagnosis just from observing. You have to do a little bit more. Mostly there are differential diagnoses that get skipped, and most people just think they have acne, especially when they have the papular-pustular form. However, contact dermatitis and rosacea, and also since we have a lot of people telling you what to do on, Instagram, people are having their skin damaged. And this is important because this is a really great picture. You can see little tips and tricks on how to, look at a pigmented skin and look for data. One of the top things that I tell all the residents and everybody that I give these conferences to is you can look at the periorbital region of the eye, and then you can look at the skin underneath, and you can see a difference in color. And all of a sudden, out of your screen comes the redness. And it's perfectly in this picture. You can see how the redness comes out. There are many, many technical applications that you can use, like dermoscopy, to help you look at the veins of the skin. But also there are other technologies that help you see the redness of the skin and evaluate how it changes with your treatments. So these help in the method of diagnosing and properly being able to execute a treatment in rosacea. And many of this is because the treatments are delayed because of the wrongful diagnosis of rosacea. And this is important because sometimes we can even ruin the skin barrier with a wrong soap, thinking that the patient has acne, and we can provoke worsening of the rosacea. So the National Rosacea Society had set several standards for rosacea, and one of those was persistent redness in central face skin. Also, the thickness of the skin, and to have one or two or more signs like bumps or pimples or flushing or irritation or visible blood vessels in the face. And this is important because most patients will come into our offices and they won't know. With Latin skin, you don't know what's coming in the office. It's because sometimes you'll have a darker tone or sometimes you'll have a whiter tone. With white skin, it's easy. With darker tones, it's harder. So you have to rule out that the patients don't have other diseases like lupus, a steroid-induced rosacea, or seborrheic dermatitis, because there's a lot of auto-medication or self-medication or over-the-counter use of products, and there's a lot of bad recommendations being given on social media. So basically for us as dermatologists, we have to look at a diagnostic criteria. From right now, it has transitioned from the subtypes to phenotypes. So right now for diagnostic criteria, we're looking at a fixed central facial erythema with thickness changes of the skin, phymatous changes of the nose as diagnostic. Major symptoms or major phenotypes that help us are the flushing, the papulopustules, the telangiectasia, or the ocular manifestations. And the secondary causes can become symptoms such as itching, stinging, or ocular signs. So once again, our third point of our meeting was talking about erythema, telangiectasia, and the history of sensitive skin, such as burning or stinging, when using skincare products, should raise the index of suspicion of rosacea in all skin tones. We have to know that if we ruin our skin barrier, symptoms are going to be there. In rosacea patients, the skin layers are already hurt, so we have to know that this is going to happen. In China, it was conducted the high frequency of cleansing the face, and the large amount of substance they used to clean the face is positively correlated with rosacea. Also, the use of cleaning and scrubbing the face, masks, and beauty salon products are also directly in correlation to rosacea and the worsening of the rosacea. And this is important because this means that we have to take care of what we use on our faces to avoid complicating the rosacea. And there are symptoms that evolve. So you can start off with one form of rosacea and take it onto the other because of you're using the wrong habits and you're excessively washing the face with the wrong products. As far as our fourth statement that we addressed was that skin barrier dysfunction using cleansers and moisturizers with ingredients such as ceramides and niacinamides promote healthy skin barrier function and improve signs of clinical rosacea and symptoms. And this is true. We have to wonder a lot. What came first? Was there an inflammation that got to the skin? Was there something that happened to the skin that caused the disruption that led to this disruption in the skin barrier? And this is important because anything that falls on our skin or gets into our skin will cause inflammation. It will liberate substances that will just promote all kinds of inflammation cascades that will cause inflammation, new vascular formation. And this is why it's important to try to think about the importance of stabilizing the skin barrier when it's ruptured. As far as that is concerned, here we can see how histopathologically the skin barrier, the stratum corneum layers, are diminished in patients who have papulopustular rosacea, and there's a disruption and there's more inflammation happening. And this is all because of the rupture in the skin barrier. And it's also important because skin barrier changes in rosacea can be also cause changes in the skin similar to atopic dermatitis, and that will just cause inflammation to just go out of control. And it's important because the papulopustular rosacea can get worsened by these conditions. So as far as how do we prescribe treatments for rosacea, we have to establish first the clinical manifestation of the rosacea patient that we have in front of us. So there are different types of rosacea. There are different clinical symptoms that help us categorize. And of course, the Global Rosacea Consensus Panel is a way of us being able to use these typical signs and symptoms that we are looking for in order to categorize our patient in what part of rosacea he or she may be. And this is important also because there are treatments to where you can hit direct problems where the skin is. Remembering that once you've controlled the rosacea, you can start then making sure repairing the skin barrier and maintaining the skin barrier. This is one of the main focuses that we have to have as a dermatologist. We have to keep, it's a triad of treatments. We have to educate our patient, we have to give the patient the correct skincare routine to take care of their skin, and then we have to add the treatments more adequate for the type of rosacea the patient presents. And here is the Brazilian consensus on therapeutic management of rosacea. And since this is a Latin American phototype skin, I love this presentation from Brazil because they do every single box. They fill in each box. They tell you rosacea, erythema, transient, erythema persistent. They have inflammatory lesions if they're mild or severe. They have the telangiectasia and all the treatments that are available in the market, and the fimatus, and if they have ocular rosacea and the granulomatoid rosacea, and every treatment, topical, lasers, they include all of them. But at the very heart of everything, they go back and they say that the general measures are fundamental once the skin is controlled to avoid triggers in causing the rosacea to come back. Most patients are looking for treatments that are going to cure them And it's very important for us to be very straightforward and talk about how we can control it and say, do this or do that. And once your skin is controlled, then stop, do this and do that. And this is why we have to do follow-up visitations on our patients. So once this is, now I will pass the floor on to Carmen Gonzalez, and who's been presented. Carmen.
Thank you so much, Charles.
All yours.
I'm going to continue. Thank you. I'm going to continue with the second part of this skin chat, and we're going to go with our polling question, which is here. So the question goes like this. In a Latin American patient, rosacea is an infrequent condition, only presents in fair-skinned people. There is not much data. It's more frequent in males. So let's take a couple of seconds to decide which is the one that you think is the correct one. And then we're going to check. Good, guys, you're brilliant. Actually, it's like, yeah, like Dr. McKeever said, there's not much data. If you look, the only study of prevalence is like Dr. McKeever said, is the one that was done in Colombia, where it says there's about 3% prevalence. It's the only one. The others that we have are mostly about recommendations and the global consents of different countries. And I think this opens an opportunity for all of us to start doing some serious research about rosacea. So I'm going to continue with the second part of the skin chat regarding to what were the results of the survey. So when we're asked what was the most common type of rosacea that we were seeing in our office, we were seeing mostly erythematous rosacea. And we were asked also what were the kind of treatment that we used for these types of rosacea. In the case of erythematous rosacea, most of us use topical treatments. In the case of papulopustular, most of us use antibiotic, in this case tetracyclines. And when we face patients with erythematous rosacea, all of us decided to use isotretinoin. The second part of the study was a very interesting one because we were asked to try to give recommendations regarding to the ingredients that we would like to see in skincare routines, and also the ingredients that we did not want it to see in skincare routines. So this first one, we were asked about the ingredients that we want to see in cleansers. And here we find out that the most preferred ones were glycerin and ceramides. In the case of moisturizers, we wanted to see alpha bisabolol and hyaluronic acid. Now, which were the ingredients that we absolutely did not want to see in cleansers? We find here that glycolic acid, fragrance, and salicylic acid we did not like to see. And in the case of moisturizers, the main ones were retinols, alcohol, glycolic acid, and salicylic acid. So based on that, we made a statement trying to design which were like the steps in education that we wanted to recommend for patients in rosacea. And these were first try to avoid the triggers and the irritants. In the case of cleansers, we recommend to use the gentle ones. They have to be the ones that have pH that is close to the pH of the skin. They have to be free of exfoliating ingredients, and be aware also that excessive cleanser can be damaging to the skin barrier. We need to use frequent moisturizer because dry skin is one of the main concerns of patients with rosacea. Also try to protect the skin barrier and using sunscreen, ideally around 50. Now, this is not new for us. We all know that it is very important to educate patients with rosacea of all this basic kind of approach of the things that are important to keep in mind. But in my opinion, this should be also considered part of the treatment in rosacea, and we're going to talk why. These are just not general measures that we're supposed to educate the patient about, but there are also some things in rosacea that are compromised, and they're going to explain why is it so important to keep appropriate basic skincare and how we can try to improve it with very basic skincare routine. So let's talk a little bit about skin cleansers and why choosing the right skin cleanser can help or can get worse the symptoms of rosacea. So I'm just going to talk about this study. This was a study that was done in 2020 in Chinese patients. They recruited over 1,000 patients with rosacea. They were all diagnosed by dermatologists, and they designed a very long questionnaire. And all the habits of skin cleanser, skin moisturizer were asked, and they found out a couple of things that were very interesting. They found out that over-cleansing, the use of soaps and foams were associated with rosacea crisis, but they also found that moisturizing and appropriate cleansing show positive effects in patients with rosacea. So what does it appropriate cleanser means? We know already that it seems that some cleansers like soaps and foams could be not the ones that we want to use in our patients, but what is appropriate cleansing? So these gentle skin cleansers, we need to know that maybe we need to have like skin regime, and for that we need to have like an appropriate routine of cleansing. And for that, this study that was designed to know that, they gathered around 300 patients with rosacea, and they saw that washing the face more than twice a day was associated with rosacea flares. And also, they pointed that higher phototypes might be a protector against rosacea, but we have to know that this might be a confounding thing because higher phototypes of rosacea might be just harder to diagnose, as Dr. McKeever said. So I just pointed that. So we have to be careful and aware that maybe higher phototypes were not diagnosed properly. So when we think about cleansers for rosacea, we need to have clear that a cleanser has to remove oil, dirt, bacteria, but it's important that the cleanser helps to maintain and restore the skin barrier. And for that, it needs to have the pH that is close to skin pH and has to be completely free of surfactants. Now, what do we know about rosacea and the pH of rosacea? This was a study that was performed in 2014, and this group wanted to investigate what was the pH of rosacea patients compared to controls. And they found out that rosacea patients, even treated, always had a higher pH. In this case, they only used as treatment minocycline, and they did not use any special care routine. So if you see the black column, those are controls, and the other two columns are patients, the ones in the middle not receiving treatment, and the ones in the right are receiving minocycline. So it's important to tell that there are alterations in the pH of patients with rosacea. And what can this mean? This can mean this, that when pH is elevated, we know that mechanisms of inflammation are triggered. When we need to build skin barrier, all the processes are basically commanded by enzymes that are sensitive to the pH. All the enzymes that are going to produce the lipids or the enzymes that are going to keep the choriodesmosomes together depend on enzymes, and these enzymes are dependent on the pH. So this is going to cause a loss, or maybe how to say it, a disruption in the choriodesmosomes, and it's going to cause less production of lipids, which is going to increase the permeability of the skin barrier. So we know that skin barrier, it's damaged in rosacea patients. They do have higher pH. We know that we can help them, or we can actually get the rosacea worse, depending on the habits that we're going to teach the patients. So how about moisturizers? It's important to know that we can help patients also giving some tips about the ideal moisturizers. We need to tell them not to use facial scrubs. Regarding to essential oils, we must be very careful because now we see patients are trying to go back to nature or the natural ingredients. And in this case, it's very important to tell them to bring the things that they're naturally using and try to read labels. I remember a patient with rosacea that I saw many years ago when I was in the US, and he was using this natural organic thing that had coumarins, and coumarins are photosensitizers. I also remember that we were at the clinic with Dr. Amy Paller. She mentioned that, for example, olive oil was an ingredient that caused eczema flares. So not because it's natural is good. We have some ingredients that are natural that have been proven to be good for rosacea, but we have to talk that, and we have to tell the patients that, and we have to convince them that not necessarily natural is good. The fragrance we know it must cause flares, so the heat, and these home rollers are extremely famous right now. So you can see that there are some very famous stars that are using them. They teach you how to use it on Instagram. The other day I saw this Instagram kind of in vogue. There were many celebrities showing you which were the best rollers to use, and we have to be careful because people are very exposed to these damageful habits. So it's something that probably we need to tell them because they might not ask and have that included in the routine. So moisturizers, we know that rosacea patients have lower levels of hydration in the skin, and therefore we have to be very insistent that they do need hydration in the skin, and the hydration must be done with quality products. So in this, we need to know that not all moisturizers are the same. When we were asked at the beginning of the survey, what were the things that we wanted to see in moisturizers, we wanted to see glycerin, we wanted to see hyaluronic acid, we wanted to see lipids, we wanted to see also all the things that could help us to maintain the skin barrier. And it's important to try to think that here technology can give us also some advantages regarding the different types of creams that are available. And for this, I just want to mention that CeraVe has his unique technique, which is the MBE. A normal cream has this that is called conventional burst release. So when a normal cream puts in contact with the skin, in 4 hours, all of the product is released and absorbed in the skin. But CeraVe has this MBE technology that is exclusive for the brand. I imagine it this way. It's like an onion that puts in contact with the skin. So this onion kind of peels off layer by layer. And in this layer, all the active ingredients, they kind of touch the skin and are delivered in a constant way. So this permits to be delivering ingredients over a period of 24 hours, which is something very good because first, it helps us to keep adherence to the treatment. We can actually have a patient knowing that they don't have to reapply the product every 4 to 6 hours, which is something good because people want to use things that are effective and easy. And not just that, when we choose a product, we need to be sure that the product is safe and effective. And for that, we want products that are ideally compounded by ceramides because we know they're part of the skin barrier. We want them to be fragrance-free, non-irritating, hypoallergenic, that they have hyaluronic acid, and we also need products that are safe. And for this, we want it to be limited of parabens, sulfates, endocrine disruptors, dyers, propylene glycol, and as I was saying, mineral, nut, and coconut oils. So let's get to the point. What do we know about moisturizers in rosacea? We know that moisturizers in rosacea are useful. Here are just a couple of studies that have proven that rosacea improves by the use of moisturizers. But I want to show you one that is a little bit more specific. This study that was developed by Dr. Belroso in 2009, he basically decided to treat patients with rosacea with azelaic acid at 15%. And he did a split phase study. So what he did, basically, he told the patients to apply a cream in the middle right face before applying azelaic acid, and the left face, he was just applying azelaic acid. And he followed the patients for 7 days. And he asked about the symptoms in the morning and night. And after doing this, he saw that symptoms such as stinging, burning, tingling, itching were all reduced after 7 days in the group that was receiving azelaic acid and moisturizer, and this was significant. So what seemed to happen? It seemed to happen that the moisturizers actually were helping in the treatment of rosacea. But what Dr. Belroso did then said, okay, I want to see if these creams are helping or not to increase the penetration of the active ingredient. He saw that when he was using the MBE technology, he actually managed to increase the penetration of the active molecule. What about sunscreen? So we know that rosacea is a kind of condition that is very associated with sun exposure. We get to see flares with sun exposure. And the guidelines recommend use of sunscreen. Studies have proven that sun protection is beneficial for rosacea. And why do we believe that sun exposure is so bad for rosacea and sunscreen is actually beneficial? In this study, they used skin samples, human skin samples, and they exposed skin samples with and without sunscreen. The first part, the first arrow, you see 20 joules, that's regular exposure to the sun. And down there you see 100 joules, which is extreme exposure. And they found out that both sun exposure, normal and extreme, were benefit with the use of sunscreen. They saw that there were less apoptotic cells and that the dermoepidermal junction tend to be maintained with the use of sunscreen. They also wanted to see what happened with the ceramides when the skin was exposed to the sun. And they saw that the total amount of ceramides was not compromised, but they saw that the types of ceramides were compromised with sun exposure. They saw that type 1, 3, and 6 were compromised, especially number 3. That one was expressed in a lower level, and they saw that the ceramides were shorter. And ceramide 2, which is not the most important and not as frequent as the other, was increased. And after the sun exposure was finished, this became normal. So the skin barrier changes with the sun. We know that. But why exactly this change in the typical ceramides happen, we're not sure why. And this is the last one regarding to sunscreen. We just wanted to show you this part and basically see that when we tend to add a ceramide moisturizer to the sunscreen, we get to see that even though this mixture maintains the effect of the sunscreen, we do see that actually patients refer that they do feel the skin with much comfort and much more hydrated. And the use of SPF actually diminishes both erythema and pigmentation. So I'm going to invite Dr. McKeever to join me for these last 2 slides. Okay, thank you. And I'm going to go with this first one. As we know, rosacea is a chronic skin inflammatory disease where the skin barrier is compromised. As he said, it was as bad as eczema. It is important that when we address a skin care routine, we try to choose one that it helps us to restore pH and to hydrate the skin in order to protect further skin damage or restore the skin barrier. As we said, there's very limited data on rosacea patients. When we see the story of skin sensitivity, we should be very careful and try to think that it might be a rosacea patient. Also, we need to see that maybe they need more studies to assess the role of a proper skin routine in rosacea patients. And we need to know that we need more studies, especially in the higher phototypes of rosacea patients, to try to increase the awareness of these patients.
Okay, and also we have to know that the choice of cleanser and moisturizer is going to depend on each preference that the patient may have also. This is very important because the wrong choice can disrupt the barrier itself and then cause dryness, itching, flaking, or other skin conditions. And we also have to know the ideal of everything, that it be safe, that it be effective, free of additives, fragrances, perfumes, avoid them. Any substance that is sensitizing is a red flag. Avoid recommending patients to use things that aren't good for their skin or that may hurt their skin, and to try to keep cleansers and moisturizers near a physiologic pH between 4 and 6. Allow for the acid mantle repair and increase microbial defense capacity. During COVID, we had a lot of issues with rupture of skin barrier prior to leaving the home because a lot of people were bathing when they left the home. So it's very important now to start educating patients to try to keep their skin barrier, because skin barrier doesn't recuperate for 6 hours once it's been damaged. And also, we have to fight and we have to take over social media as dermatologists in order to educate correctly on proper skincare. And this is very important.
Well, thank you so much, Dr. McKeever and Dr. Gonzalez. So right now, we're going to pass to our question and answer period. Again, please submit your questions using the question chat pane on the right-hand side of your screen. And if you think of any questions after the end of this webinar, you can always send them to info@rbcconsultants.com. Thank you again to our sponsor, CeraVe, that has made this educational event possible. So a couple of questions from the audience. What about rosacea in pediatric patients?
Okay, so if we know very little about rosacea in Latin American patients, we know less in pediatric patients. There is absolutely very little published, but we do know that the pustular forms tend to be more frequent, and that there might be a condition called periorificial dermatitis, which is common in kids, which is a condition that they have papules around the mouth and around the eyes that is associated with steroid use, that is supposed to be a precursor for rosacea. And probably that's the most common forms of rosacea that we see, they respond to the treatment that we use in rosacea, but there's not much information differently to adults. We don't get to see like the phymatous one. We don't get to see like the erythematous one. You can see telangiectatic in children, but they don't work or they don't act like the ones that we see in adults. And there's very, very little information. Actually, there are no criteria for rosacea in children. Sometimes we do see dermatosidiosis in children, which can also make the diagnosis of rosacea a little bit difficult. Sebderm we see also in adolescents, which can make the diagnosis difficult, but there's very little known about rosacea in children.
I think your part, Carmen, education is very important also, because parents will use any soap on children, and this is where we have to, you know, as dermatologists, intervene.
Yeah, in Chile they love glycerin soap. I don't know why, because they think it's natural. I think this natural thing it's really driving us crazy here, and they're going to everything organic. Everything that's organic they think is great. I don't know how if you have that problem there. I remember when I was in the US, everything was organic, and I think there is a problem there because they think it's safe and believe that because it's natural, it's something that it's less harmful, but it's not necessarily so.
A lot of things that say they're organic, they have to have the proper seals, and it's very important to know what seals are certified seals of vegan, organic, because soaps, if they have that smell, they've got perfume in them, and you walk by the stores and you can smell the soap, and it's just not a good thing.
So on that same thought, how do cosmetics play a role in rosacea?
You want to answer that, Charles?
Oh, sure. Well, you know, cosmetics, the whole problem with cosmetics is, once again, everything is at the reach of a patient when it's over the counter, and there's no one sitting there telling them, oh, you may want to think about not using that product because that product could be harmful for your skin. Pharmaceutical companies and dermacosmetics are different because the products are, you know, safer than others. However, there's a lot of over the counter, and there's a lot of, you know, recommendations coming out of social media and the internet and YouTube, and we have a generation of people that have access to wrong information. And basically, this is where the proper skincare routine becomes very insistent on our behalf or on our part, is explaining gentle cleansers. If you're doing a treatment as a dermatologist, you have to realize that once we take a skin from oily to normal, we have to change the treatment or we're going to dry it up. And so we have to have combination of treatments depending on how our patient's skin goes. I always tell my patients, when it's a woman, it's very difficult because women have friends and all their friends have an opinion on their my dermatologist changes my cream every 2 days. And I'm like, what? No, as if it's working, you don't need to change it. However, with men don't talk about skincare. They're like, oh, what do you use today? No. Boys don't do that. So it's more difficult when it's a woman. And with the makeup, oh God, you have the brushes, the foam. If you touch it, it's contaminated with bacteria. And then you do this, and then you do this. You're contaminating your makeup. So you have to be, I try to teach on social media, and once again, I sound like a social media guy, but I've had to take this because there's too much wrongful information and it just hurts the skin. So we go back to skincare. Go back, don't do that. Don't use this, avoid that. Triggers have to be removed. If you have rosacea, you have to be careful because not everything's good. What about you, Carmen? Is there anything that you see?
I agree with you 100%. I think there is a lot of misinformation there, and especially when some influencers, or even, like I was saying, some people that are famous are giving their skin routine, and because it works for them doesn't mean it's going to work for other people. And sometimes they do some damageful things for skin. Like I was saying, with these rollers that are very famous right now. I don't know if you remember this kind of cleansers that they use that had like a brush or the silicone head, that
Yeah.
actually they were very dirty and very gross, but people loved them for a while. So it's probably just keep it simple, keep it useful, use the correct ingredients, and use things that are dermatologically proven and accepted. People sometimes they believe because they buy expensive things, they're better, or they have maybe more results, which is not true. And that is something that we get to see a lot. Sometimes I
Well,
really
and
see
for
that.
me, example, in Latin America, one of the things that's very important, Panama has one climate, Chile has a complete different.
Yeah,
So
yeah,
in Latin America, you have to take into account the time of the year, the season of the year. We have rainy and non-rainy. That's all we have. And we
yeah,
have humidity and you all have cold.
yeah.
So skincare has to be different during the cold weather. I have patients who will go, I'm going on vacation. Where are you going? You have
Yeah,
to change it. Don't use that soap. Use this if you're going to travel. And this is important because if you're traveling to a different country, you have to know what to do in that country. So it's always good to, give out warnings. If you're traveling, come visit your dermatologist.
yeah.
You
I
may
Well,
need
always,
something
actually,
else.
we do have a question about that. Is heat-induced rosacea more common than cold-induced rosacea? And would you treat them differently?
Well, basically, I'll take the first part if you want to think for a
mhm,
minute. The cold rosacea is more harmful because the cold, your skin is going to defend itself trying to get the temperature going there. So in Panama, we live in air conditioning because nobody can stand being outside. It's too hot. So we enter and exit. And as you enter and exit from extreme temperatures, your skin has inflammation, has cascades of inflammation, and the cold will dry your skin. So it's going to disrupt the skin barrier. Therefore, the treatments that you're going to use, your general skincare has to be modified. And also you have to take into account that you have to use things that repair creams. You have to use different substances depending on how cold it is versus how hot it is. In heat, I don't feel that it's as tough, but you have to go with lighter textures. It has to be more liquid, emulsives, softer hydration, and not so thick, to protect the skin, because in cold weather, the skin will just crackle. I don't know if,
well, what I have noticed when people passes this from cold to hot or hot to cold, the problem sometimes is when the vessels delayed and contract, there is a point that this switching is lost, because since there is inflammation, there is loss of collagen and support to the blood vessels. So you need to try to avoid that. So there's a moment when the vessels are just gonna go loose and they're gonna be forever like in the same shape, like dilated, and you're gonna start presenting the telangiectasias and the present erythema. So that is why it's bad. That is why you go red, because the blood vessels, they contract, or let me go this, maybe you see contract, dilate, contract, dilate. So at some point this is going to stop. Just going to go like this. And you need to be aware that that is not good, because the skin in rosacea is hyperreactive. It reacts in a different way. That's not normal. Like when you go in and out weather, just like going from normal to red to this flashing, this is not normal. And at some point that flashing is going to become permanent. In terms of treatment, what we try to do in those cases is always, like Dr. McKeever said, is try to control the inflammation, because the inflammation is what it leads to this kind of response that is not normal. So besides always being very insistent with trying to avoid the triggers, because you have to do that. Unfortunately, we cannot change the response of your skin, because it will respond like that, because it has absolutely this kind of anomalous response that we cannot change, but we can help with inflammation, and you can help trying to avoid these things that you know they're not good for you. But we try to keep the inflammation as low as we can.
So
it's
in terms
important.
in terms of treatment, one question is, what dose of isotretinoin do you use in patients with rosacea?
I use 0.1, 0.2. That's the one that I use. Very low. I don't know you, Charles, if you use higher, or how much do you
I
use?
use lower because the skin is more sensitive and it's going to react, and I don't use it daily. I use it maybe
No, me
like
neither.
Thursdays or Monday, Wednesdays or Monday, Thursdays, just depending. And I suspend all type of irritants on weekends because you're more free to be outside. During pandemic, however, it got worse because everybody was on their computers and nobody was using sunscreen because nobody thought that blue light has anything to do with skin. So once again, sunscreen is fundamental, and moisturizing and sunscreen combined is very convenient for men. However, you have to add sunscreen throughout the day because you have to reapply, and it's very difficult to get people to do that.
Absolutely. Yeah, that's one of the problems that we were talking about, that this is something that it's permanent. Unfortunately, you have it and you have to bear with it. So you need to cope with skincare routine and treatment. And for that, we need to try to keep it simple. So the idea of looking for the best skincare routine is to try to keep it simple. And in that, there are many things that we can do. We can use a moisturizer that is long lasting. We can use a moisturizer that has SPF that is long lasting. So there are things that we can do. We can use an SPF that has color to try to cover a little bit the redness. But it is chronic, and you're gonna have good periods, bad periods, and that is the way it goes. But in case you decide to use isotretinoin, I do the same as you. I go very low dose, and in Chile we tend to use it like every other day or 3 times a week. We don't go much than that.
One question that's interesting: are you born with rosacea, or is it a disease that occurs with time?
Do you want to go, Charles, with that, or you want me to?
Well, there's no clinical study that says it's at birth or genetic or congenital, but there are hereditary factors to take into account, because you can see in families that are exposed, or people who have parents who have rosacea tend to have children who have rosacea. And once again, I may be, I'll go back to when we're born, our parents didn't know how to do proper skincare, and we're using the wrong kinds of soap to wash their faces. So this is where we're going to go in and start educating new generations on proper skincare, and in order to avoid the triggers that take you to rosacea and the disruption of the skin barrier. So once again, we go back to my question that was my polling question. Where do you want to go, with skin barrier or you want to go with skincare? You have to do both. And I was pretty happy and pleased with my result because everybody was on key. You have to have both, but you only can pick one. So which one are you going to go?
And in terms of skincare, we have a question on how to choose the best cleanser for rosacea patients.
Well, ideally not foam. We know that soaps are not good. It has to be pH that is close to the skin, between 4 and 6. To have to use it twice a day. You have to set fragrance free. Also that it's gentle with the skin, hypoallergenic. I like cleaning lotions. That's like a personal preference. I don't know if you prefer that, Charles, or because since the skin is dry, I don't want to dry it anymore.
We don't use tonics, for example, and we avoid those because tonics
I never use tonic.
Like every commercial line has a tonic out there.
I don't like them.
No, I prefer the mixing of the micellar solutions with the soaps. First, remove the makeup, then wash your face. I tell women when they wake up, because women have estrogen and progesterone flux, skin changes during the menstrual cycle. Be aware of what your cycle is like, and then choose the proper skincare soap to clean your face. When you're waking up, you are in your bed. You don't need a harsh soap. You don't need something that's going to destroy your skin barrier because you're going to go out. So clean, yes, because you have to remove any, regenerative creams that we do all use to keep ourselves youthful, but you don't want to harm the skin in this process before you leave the house. So then try to use a hydrating cleanser, try to use something that isn't so cleansing unless you have acne, then it changes. But if you have rosacea, you have to calm the skin. So you don't want to irritate the skin before you go out because you're going to go out in the sun. And then you always have to protect the skin from the sun exposure. And I try to avoid the word sun. Years ago, I've been talking about light exposure because all forms of light will burn your skin. And it's a slow process, but it's getting there. The information gets there. So just use the right kind of soap depending on how your skin wakes up. If you wake up too oily, try to control the oil, but then you must go back and hydrate. Because if you don't repair what you damaged, then your skin's just going to reactively produce more oil.
Well, that's all the time that we have this evening. I'd like to thank Dr. Gonzalez and Dr. McKeever for an excellent presentation, very enlightening. And I'd like to thank you all for joining us. Now remember to join us next month for our next Skin Chat on July 12th, same time, when we're going to be discussing the importance of skin barrier and psoriasis and skin of color. So good night, everybody. Good night.
Bye, thank you.
Thanks for watching.